Welcome back to my channel, Mis.Medicine. Today I am sharing most important topics for Fmge. First subject is anatomy. Important topic in anatomy is skull foramen. Its name, position, bone, structure and related to their syndromes. Next is brachial plexus and brachial arcs. Next subject is biochemistry. All tables are important in biochemistry, but mainly like glycogen storage diseases, purine pyrimidine diseases, autosomal dominant and autosomal recessive diseases. These are important. Next subject is pathology. Pathology, table of hypersensitivity. You can prepare this table from Robbins. Next is table of renal disorders like nephritic, nephrotic syndromes and their treatments. It's just example. Next is CD markers table. CD markers table are asked in medicine and pathology both. Next subject is microbiology. In microbiome culture media, solid, semi-solid, liquid. It covers all bacteriology. Method of sterilization, its table. Next is rickettsia. I will show you in the picture. All type of rickettsia you need to prepare. Next is vector table like Anopheles. It comes or asked in microbiome and PSM both. Next subject is pharmacology. Pharmacology, drug of choice for common diseases, and you can also watch my videos of drug of choice. I already uploaded. Drug of choice for communicable diseases, PSM diseases, hypertension, non-communicable diseases. Table of side effects, drugs and side effects. You have to prepare in reverse table, side effects and drug. Question can be like, which of the following drug does not cause nephrotoxicity? This is example. New drugs. New drugs rarely asked in Fmge, but mostly it asked in PGI entrances. Next is antibiotics table. Its mechanism. Cell wall, cell membrane, mitochondria, RNA, DNA. Next subject is forensic. In forensic, toxicology table and IPC section. I already uploaded IPC section and toxicology video. You can also watch that videos. In IPC section like simple injury, murder, grievous injury, rape. These are most important topics in IPC section. Next subject is pediatrics. In pediatrics, milestones tables, vaccination, immunization. Next subject is physiology, coagulation factors. In pathology also important topics, necrosis, inflammation, tumor markers, genetic hepatitis, iron deficiency, anemia. And in ENT, nasopharyngeal carcinoma, muscle supply of larynx, PSM, epidemiological study, nutritional poisoning, pregnancy, vitamin deficiency tables. Next subject is gynecology. Amenorrhea, diseases associated with pregnancy, contraception, infection, mode of delivery. Dermatology, image-based questions mainly like psoriasis, lichen planus, impetigo. In anesthesia, you can prepare from the Dr. Deepak Marwa book, last pages. Radiology, abdominal X-ray sign, pneumothorax, pneumonia, pleural effusion, etc. These are the important topics for the radiology. Next, overall like dimensional, cataract, diabetic retinopathy in ophthalmology. One test cataract, biometric scan for iris, component of mediastinum, neural tube defect, ORS concentration, breast, thyroid, gout, Parkinson's, Alzheimer's, tuberculosis, typhoid, John and Duke criteria. This is PSM. Image-based questions like muscle related to scapula, nerve supply of upper arm, grey matter, white matter of the brain, blood supply of the heart, stomach, circle of villi, lower branches of aorta, blood supply of lower limb, and also stomach bed. Write me in the comment box if I forget something. I hope this video will help you in your preparation. You have to prepare not just these topics, you have to prepare more topics. Study well, go make it happen now, because it's never too late to be awesome. Keep sharing, keep watching. Thank you.